Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome back to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from HIMSS25 in sunny Las Vegas. Very excited to be here. It's already been an action-packed 72 hours. The HIMSS annual conference is always the centerpiece of my annual schedule, and this happens to be my 25th HIMSS annual conference and my 11th year broadcasting from the annual conference, which leads us to today. This is the start of 3 days, 5 shows, and over 40 guests here in Las Vegas for HIMSS25. We have our best lineup yet of CEOs, CIOs, CTOs, care providers, researchers, policy leaders, and visionaries joining the show. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, key strategies, and actionable intelligence from the industry's leading sources and experts. My objective, along with all my guests here, will be to offer tactics and strategies to not only survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all these changes occurring across healthcare today. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of this over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from HIMSS25 in sunny Las Vegas. I'm very excited to introduce my next guest, a new friend of the show, Adam Resnick, Director of the Center for Data-Driven Discovery in Biomedicine from the Children's Hospital of Philadelphia, or better known as CHOP. Welcome to the show, Adam.
Thanks for having me.
Appreciate you. When did you get in town?
A day ago, but this is my first HIMSS, so this has been amazing, I have to say.
This is my 25th HIMSS. This is your first HIMSS?
My first one, actually, so it's amazing.
Well, I had the pleasure to meet you at dinner last night. Before we dive into to the show, tell us a little bit what you most excited about a dinner like that last night brings to you. And having all those people in one room and that type of a quality conversation, great collaboration, great thought leaders. But what does it bring to you personally?
So I've been at CHOP for almost 18 years now, and I've seen the healthcare framework really transform and change in ways that, when you are at a pediatric hospital focused on rare diseases, very challenging diseases, leading cause of death for children. Mm-hmm. You have a high anxiety framework on how do we do this faster, how do we do it better.
Right.
And the credo for pediatrics is through collaboration. So we collaborate across institutions, across networks. And for me, last night was sort of an amplified version of that, right? And for me, this is partly why I'm so excited to come here to HIMSS, is because that collaboration framework that brings really transdisciplinary, transdomain thought leadership into solving complex problems that are newly enabled through these emerging technologies is, a phenomenally exciting time period.
I agree. I love it. We've been almost every single guest has been talking about what AI, Gen AI will bring, and also just the faster treatment protocols. And we'll get into some of this as a show. But what progress are you most excited about seeing in the industry right now?
So, I grew up matriculated into healthcare, right around the same time that the first human genome was sequenced.
Okay.
Right? And for us, and those of us who are really interested in transforming healthcare, suddenly we had the parts list of what it means to be a human being. But that was in 2001, 2, 3, right in the early 2000s. But it just started creating new data layers on top of what it means to really think about health. Yep. So for me, the really exciting framework is that alongside with this increasing capacity to measure and understand biological context for health, we have now the technology framework that starts to pair with it. And then now, in the context of AI and these technologies, we have the interpretive framework on top of that. So, we have computation and analysis with multimodal data, and now an interpretive layer that really provides access,
Yep.
not only to those who can code in R or Python, but to the clinicians and researchers who are actually at the front lines of driving that discovery framework.
I love it. So, and I heard a little bit from you last night on what you're working on, but for my audience, what are you working on that you're most passionate about?
So for me, CHOP is a very large, enterprise healthcare system, and I arrived at CHOP in the early 2000s, immediately recognized that to advance the care and discovery framework required for pediatrics, we'd have to work across institutions.
Yes.
So for me, from the very beginning, my most exciting framework of engagement was not just what science or translation for care we could do, but it's the how.
Yep.
And I think that how you can actually do science and rapidly translate it to care, that has completely transformed in the last 5 years for us. We always knew what science, we thought we knew what science had to be driven forward. How, what do we need to march forward on behalf of cancer or other, deadly diseases? The how of it completely transformed. And for me, the how of doing that in the context of collaborative networks, both at the hospital or enterprise layer, but also at the technology and commercial layer, and then at the federal layer, suddenly that mix is providing opportunities that are unprecedented.
What was the major change, or what's the major evolution over the last 5 years that made that happen? Is there something you can point to?
So I think, I always say this, that, hospital systems, I don't know if everybody agrees, but that hospital systems in some way historically thought of themselves as grocery stores, right? You come into the grocery store, you get the care you need at that grocery store, then you leave. And I think what changed is that suddenly it became clear that we could actually add value to the care framework, to the discovery framework through connection. Patients always had this in mind, right? Patients naturally connect, right? If you're diagnosed with a rare condition, you immediately go on Facebook, find a Facebook group, right? But the enterprise and research framework only very recently, it feels like, began to recognize that the value proposition of connecting, sharing, actually empowers the interpretation and value of their own data, right? So the four walls, right, of the institution suddenly become fenestrated. Not just because it was the right thing to do to advance and accelerate research or care, but because it actually added value. So suddenly the incentive frameworks of both connecting and sharing aligned in ways that completely changed. And part of it had to do with the technology landscape.
Right.
Because of cloud technologies and ways to share data became finally prevalent in a way that were not there before.
Yeah, I love it. Congratulations. What are some of your goals for HIMSS25, and what do you hope to accomplish over the next couple of days here?
Yeah. I think I always say this, that historically, in the context of rare or pediatric settings, the narrative has been, we'll figure this out, for common disease or prominent disease landscapes, and then that will filter down into the pediatric or rare disease setting. For me, my objective at HIMSS was really to present the pediatric setting as an opportunity to innovate, as a extremely agile sandbox for innovation around technology in ways that we can move rapidly, engage rapidly, have patient communities and networks that are driven to accelerate the process above all as a framework. And so it's really communicating that vision that, as I look around HIMSS at all the technology enablement frameworks that are here on behalf of healthcare and transformation, to bring to the fore the opportunity in pediatrics. In part because pediatrics and rare diseases are thrust into the context of precision medicine the minute you are in there, right? You don't have a recipe for a cure, so you have to engage in this iterative, like, how do I treat this patient? But the reality is that precision medicine is something you want for every patient.
Right.
And so for me, that's one of the key opportunities and conversations that I'm having while I'm here.
So following that train here, because most of my guests, we talk about what Gen AI is doing for us today, what we plan for it to do tomorrow, some of the great care it's actually been able to assist with today. What do you see as Gen AI helping you specifically?
So for me, we work with large amounts of clinicians and researchers in ways that, despite our capacity to generate more and more data, their capacity to interact with it has been through a straw, essentially, because they had to find the right person who can analyze it or interprets it. So while Gen AI and AI writ large is going to empower, right, discovering new drugs or new proteins or other contexts from an analytic perspective, the most exciting thing for me is seeing that light that sort of sparkles in someone's eyes when they can suddenly interact with data in ways that they could never had before. Because suddenly you can engage their domain expertise in ways that was blocked, right? These are incredibly intelligent clinicians who have spent their lives caring for patients. But for them, data was not an enabler,
right?
It was a burden in some ways. So suddenly seeing that transformation where Gen AI can empower essentially clinicians and researchers and others to interact, communicate with data in ways that increases their confidence in their interpretation, in ways that bridges across domains as a translator, actually, even in complex organizations. All of that, I think, is like, it's a techno-social component of Gen AI that is transformative for
Phenomenal
healthcare.
answer. Looking into the proverbial crystal ball, what do you see as a strategy or trend that we need to be ready to navigate in 2 or 3 years from now?
So we've seen this in the pediatric and rare disease, and when it comes to healthcare, for a long time, which is if you're a parent whose child is diagnosed with a rare disease, a large portion of these parents, irrespective of what level of biology course they took in high school or college, become extremely informed, right? They know which trials open when, what happened on a trial. Historically, healthcare has been paternalistic, right?
Absolutely.
Compared to their interaction with patients. I think that's a sea change that is accelerating, where who and how decisions are made, the boundary of where that happens is changing in ways that we both have to empower, in ways that we have to, as a healthcare community, lean into, because we have to lead into that framework because of the accessibility that emerges around healthcare, its interpretation, decision making, and a process that historically has been gated for many patients. So I think that's a sea change that I see transforming. Part of this is this intersection between policy framework like the 21st Century Cures Act and other frameworks that intersect with the technology side of things. It's almost like this perfect storm of data enablement and decision enablement that families and patients can have, and we have a responsibility to help them do that right.
Yeah. I mean, that's exciting to look forward to. I mean, and I totally agree. It's on the cusp. We're on the way there, and that's exactly the situation that we're walking into. So I love it. I mean, it's exciting.
It is.
Also. I mean, I love it.
I think there are people who are worried about it or want to prevent it from happening. You can't. It's going to happen. So we actually have to lean in, ensure that it happens in the right way, in an informed way, that people can assess it and really harness it. For us, and patients are probably our strongest partners, right? They advocate, they're our shield. That when we want to do something hard, they're going to stand there and say, okay, go ahead, do it, right? We'll work with you. And so having that enablement really, extend beyond the boundary of the four walls of an institution or the healthcare enterprise is something that's going to happen.
So lean in.
And lean in.
Love it. Great advice. Adam Resnick, Children's Hospital Philadelphia, CHOP, thank you so much for joining us.
Thanks so much for your
awesome.
time. Love
Appreciate it. Thank you. Love it. Thank you.
Care.
Welcome back to This Just In Radio Show, broadcasting live from HIMSS25 in sunny Las Vegas. I'm very excited to introduce my next guest and great friend of the show, Aneesh Chopra, author, innovator, former US CTO, chief strategy officer with Arcadia, an all-around great guy and friend of Justin Barnes.
Friend of Justin Barnes, that was my line.
Love
you
it.
Took it from
yes,
me.
I know. Big welcome back to the show, my good friend. How are you?
I'm great. I'm excited to be here. Energy's high, by the way. Wow. Isn't that it's interesting, right?
It is. And we're just going to be starting the conference for the first time, but I'm sure you've been here for a couple of days. When did you get
Monday.
Monday?
Yeah. Yesterday was the pre-conference, so there was the executive forum. So you saw, there you see a lot of trepidation around the state of the financial order. It's a really wild moment. There's this insane financial pressure at the health systems. There's excitement around AI and the possibilities, and there's I'm going from disbelief that we can make interoperability work to now I'm getting data. What should I be doing with it? So there's this like really interesting high, low, everything in between.
I agree.
But then between that and then the interoperability forum, where people are much more like, there's a mindset, Justin, which is, we've been trained over the last 10 to 15 years to wait for the Moses tablets from Washington.
Right.
What are the instructions? What are the rules?
Yeah.
What do we have to do? How do we comply? And I kind of communicated a message which is like, it's on us. We got to collaborate. We got to go to Washington to say, hey, we're collaborating in this way. Help us scale what works.
Yep.
And in a way, that's how markets are supposed to be. We kind of had this kind of market correction on account of the High-Tech Act.
Right.
And now that chapter is evolving and we're ready to get back to, let's call it business as should be,
right?
Which is industry-led consensus standards.
Well, and we're actually giving you props before you even come on air. Dr. Davison has become a really good friend of mine. I know that you know Dr. Davison too. How you are the public-private collaboration, and that's actually when we first met. You were in the White House, and you brought a lot of us from the private sector, and we had some great discussions, and you're a phenomenal collaborator. So I commend you, because you actually kind of gave us the blueprint for a lot of that collaboration.
Well, you're very kind. It turns out, life can be easy, and MacGyver can get things done in 90 days. That's right. So we said, why can't we get this done in 90 days? Yeah. And so we built why can't we do Blue Button to veterans?
That's right.
And just to share one little vignette.
Yeah, please.
Peter Levin, who I love dearly, was the CTO at the VA, sort of in my dotted line orbit. And the president was going to give a speech to the disabled veterans of America in August. And we said, hey, you should announce that we're going to do a Blue Button program where veterans can have access to their own data. So that was sent as a formal request from the White House communications team over to the VA Secretary's office. And they politely declined and said, we don't have that in the budget, it's not ready, he can't really announce it. And that was a bit of a bummer.
Right.
And under normal circumstances, you sort of accept this and you move on. But I knew the president would really like this message, and I knew it could be done. So I called Peter Levin and I said, Peter, I'm going to override this feedback and say, no, please have this line added into the speech, because I believe this can be done. I said, and Peter Levin turned to me and said, my hand in fire, I promise you, we will deliver this by Veterans Day.
Amen.
And I asked the president, and he was ecstatic. It was the second loudest applause line following the announcement of the end of the combat mission in Iraq.
Right, God bless. I love it. That's awesome, dude.
90 days, we can get things done.
Absolutely, we can. What progress are you most excited about seeing in the industry right now?
AI. I mean, come on.
Yeah.
It's both hyped and overhyped and underhyped.
Correct. I totally agree.
But the reality is, on the ground, if I'm getting 65-page CCDs, I can summarize them. If I have a physician encounter and I record the audio and I can transcribe, I can bypass all the coding and the whatnot and go straight to communication and coordination for post-acute services or post-visit services. So, man, this stuff is real.
Right.
And I've got a lot of confidence that we can move at a faster clip of progress in the next 5 years than we did for the last 15.
I completely agree. What are a few areas that you see where Gen AI is going to make the biggest difference?
Okay, so my hope and aspiration is we've talked before about this idea of a health information fiduciary.
Yep.
So what's happened is the TEFCA networks agreed that a consumer who does the Face ID selfie with ID.me or Clear, NIST IAL2 standards, that's all a mouthful, by the way, that a consumer validated can request and aggregate their records. And the original theory is that individual apps that we never heard of are going to do this. But what about the apps we know and love? Why can't my Epic MyChart do it for me? Why can't a health system's untethered patient portal, like Oracle announced earlier this year, they're going to have an untethered portal.
Right.
So it may be that my health plan, my provider, the local health system may offer me the data aggregation services. So there could be a race for consumer activation between the incumbents and the startups, which is a healthy race.
Absolutely.
Right? It shouldn't be startup only.
Right.
It's all of us racing to help us coordinate the care for our loved ones. That's really fascinating.
Love it. What are you currently working on that you're most passionate about?
Well, I'm definitely working on the data infrastructure that allows for the AI revolution to thrive.
Yes.
So part of this is we've spent the last 15 years in EHRs maximizing encounter-based visits.
Absolutely.
And what we need is patient longitudinal visits. And so part of the reason I love value-based care is they bring in the longitudinal claims data. So you add from the encounter the longitudinal claims and then the interop to pull in the other clinical data. You now have a fully cleaned timeline on which you can build models. Is this patient's trajectory on or off track to guidelines?
There you go.
And how do we communicate that? So Arcadia has really been a pioneer since its founding in the data aggregation business.
You also founded, you created that from Medicare. You basically told Medicare, unleash your data.
Well, So these are two exciting phenomenon. In the Medicare world, we created in Medicare a longitudinal claims data set. We merged Part A, B, and D claims, and then added in Medicare Advantage and TMSIS Medicaid. So you could look up patient 11101 and see a story. And so Care Journey was born on the idea that we could measure, did that story adhere to guidelines or not? Right. But that's de-identified aggregate, so I could score a doctor. Dr. X, who treats patients with back pain, have this outcome relative to their peers. Arcadia was doing the same thing on the identifiable side.
Right.
So you take the identified and the de-identified and you put them together and you've got a much richer way of evaluating patient adherence to appropriate evidence-based pathways.
Which we love,
So I'm waking up every day excited at work because it's like, hey, we're actually at the heart of it. And our members are excited about joining this revolution with us. So we've got ACOs who are like, we're bigger than just the Medicare shared savings contract.
Absolutely.
We want to do this for commercial, all lines of business. Right. So this decoupling of the data infrastructure from the contracting vehicle is going to be the mechanism that will unleash this revolution, in my view.
Yeah, so following that to the end there, you will, what are the main benefits as a patient that you're going to see from that type of strategy?
Unquestionably, you'll get the feedback you deserve as to whether or not you've been diagnosed accurately with a condition and whether the proposed treatment adheres to guidelines.
That's exciting.
How do I know if my mom's getting best practice?
Amen.
She was told to do this test and then do that medication. Is that the right one? Does it conflict with these other things? I'm there Googling. Now I'm ChatGPTing as much as I can to figure these things out. I want to make it easier for me to care for my mom and dad.
Absolutely. I love it. What are your goals here over the next couple of days? Other than doing the show? Collaboration. Note that this is the first HIMSS in a while where we don't have any formal Washington messaging. Right.
Which is either a negative in the sense that we don't have the kind of Moses tablet messaging.
Right.
But it also is a liberator to say, well, could we self-organize? Do we devolve into, well, let's just optimize the boring stuff we're doing now?
No.
Or do we actually say, look, we kind of know where we want the healthcare system to look like, even in our own individual markets? Can we self-organize to improve scheduling, checking in, patient experience, provider search? Those are not pieces and parts of the traditional meaningful use program.
Right.
But we're launching this idea of a race to the top for consumer experience as an extension of the work we've been doing in the original meaningful use program.
Challenge my audience, challenge my listeners, challenge our industry. What would you challenge us to in following that?
Ambitious but achievable standards acceleration. What that means is if I wanted to connect to do scheduling for my mom and I wanted to help organize her life, at the moment, there are vendor proprietary-led solutions, and there's some great ones, and we love the market.
Sure.
But if there was an open standard, if 6 organizations said to their EHR vendor, I would like to expose this to an app that I trust, but I want it to be in the same protocol, whether it's health system A, B, C, D, or E. If we organize that demand signal, then we can work on what that experience will look like. I've heard from the EHR vendors, if they hear from their customers, they're very responsive.
Right.
Like, it's only when the government is saying go left and the customers are like, just keep us incrementally moving to the right, where the vendor's like, where do I allocate my developer resources? And that's the gap we've been in for the last 10 to 15 years.
Excellent. Well said, my friend. So looking to the proverbial crystal ball, what do you see as a strategy or trend that we have to be ready to navigate in 2 or 3 years from now?
Consumerism actually has been like the wish list, and then it fell off the wagon.
Right.
I think it's back on the wagon.
Good.
And I tell you, Peter Lee wrote the best book in the market on AI with Zach Kahane and at Harvard. And I love Peter. Peter was at DARPA when I was in the White House, and so I just love the man. He's at Microsoft Research. And he had an early version of GPT-4. So the book was like, what do I see in GPT-4 before it was commercially released? He took his lab results from a typical LabCorp, whatever, PDF file, no Fire API, nothing, and just uploaded it to this secure channel and said, tell me anything in here that I should be worried about.
Right.
And then ChatGPT was like, look, you got this issue, you might have iron overload, and he published in an open source way those results. So you're like, wow, if this is trustworthy, I could assemble my longitudinal record and I could ask an AI to guide me. I'm happy, and I hope my health system will do it for me and be the trusted intermediary, but I want that function.
Right.
And it's going to come to us much faster because every frontier model AI lab has said healthcare is the happy place where they want this to have the greatest impact. Well, let's go. Let's bring it to life faster.
I love it, dude. Fantastic. And I completely agree. What do you hope to see from maybe this conference over the next day or so, just here on the show floor? What kind of collaboration or what kind of progress do you want to see?
I do an off-the-books meeting courtesy of Tom Leary at HIMSS, who I love.
Tom will be here later on Wednesday, Thursday.
And, for the last 6-7 years, maybe even longer, Tom has organized a fire roundtable for the accelerators.
Perfect.
And it's today, by the way, live, Tuesday, 2 to 3:30 p.m. at the Caesars Forum, room 106. It's Tom's room.
Yep.
And we usually get 50 to 60 people, and it's all the early adopters. So the 6 that I alluded to, some subset of the folks gathering today will be in the 6. And there may be multiple pockets of 6. Yep. The one that I'm most interested about today, and what I announced last night at HIMSS, the Interop event, was a neighborhood watch program. If ONC is supposed to be doing real-world surveillance of the EHR deployed fire endpoints,
right,
they're not staffed yet to fully go do that at every neighborhood doctor's office, but we can collectively do that as a neighborhood watch. So I want to get all 300 certified EHRs that are compliant with the G10 Cures Act fire server tested in the real world. And then I think we're going to get to some kind of improvement on service level agreements in a future rulemaking that'll help take the neighborhood watch output into feedback for what rules should look like for EHRs to work.
That's fantastic. Aneesh Chopra, thank you so much for joining my show, my friend. You're
Justin,
awesome.
You're the man.
You are, brother. We'll see you. Thank you, dude.
You got
Appreciate it. That's a wrap from Las Vegas and HIMSS25. Thank you all for listening. Thanks to everyone who voted us 2024 Healthcare Podcast of the Year. Thank you so much, Roberta Mullen, Greg Masters, Carol Flagg, and the entire crew at the Healthcare Now Radio Network. They've also been producing my show for 11 years, and it's a true blessing to be able to do this every single year. Also, a special note of thanks to Jake Reed, my head of media. Jake did a phenomenal job managing our remote broadcast while here at HIMSS25. Again, many thanks to all of my show partners, AMD and AWS, and also a shout out to Medallion here, who gave me water for my shows, certainly my lasting shows. So thank you very much. And then also Bright Hour has a foundation that I want to make a special shout out to. Seppi Browning, Georgia HIMSS, she put together this new foundation to help with workforce development and education in health IT. So Seppi Browning, she's fantastic. HIMSS Georgia chapter, they're always great partners and supporters of my radio show. Great people. So look up Bright Hour Foundation and give her some love and support. And certainly a big thank you to Hal Wolf, Albie Zakes, Morgan Searles, the entire HIMSS team. They're always extremely supportive in the events and broadcasting requirements that I have. And again, thank you so much to all my listeners. We're grateful for you. You make us better with every broadcast. And that's a wrap from Las Vegas. Have a great rest of your day, everyone.